So how important is this vending machine in your view?
In my view, it's extremely important. In the last several years, we have seen more and more persons coming into St. Boniface Hospital with substance use. We've also seen individuals seeking supplies to help reduce some of the secondary consequences of substance use, for example, the reasons for the naloxone kits. But there's also, unfortunately, realities of persons living within our community who have other unmet needs. They need socks, they need underwear, they need hygiene kits. And so those basic dignity human supplies will now be available for free for individuals in the community and also patients that we have currently at St. B.
I understand St. Boniface Hospital is actually the first hospital in Manitoba and maybe even in Canada to have a vending machine of this kind. What prompted the discussion around, around getting this?
It's a good question. So we are the first acute care hospital in the country to be offering this machine. It really started from a group that we have at St. Boniface called the Substance Use Working Group. They're tasked with trying to provide initiatives and supports for those who are using substances, and that group has been working on things like sharps containers in bathrooms and appropriate policies to help persons that are using substances receive ethical treatment at St. Boniface. But it also started to see there were trends that were coming forward that were showing that we needed supplies both on an inpatient and an outpatient basis because persons were coming to St. Boniface for supplies, for naloxone kits, for safe injection supplies. And then it started to also show, unfortunately, with HIV being what many would call at a critical level right now in Manitoba, accessing self-testing kits is also at front of mind for many of us at this moment.
Where is the machine physically placed?
It's currently in the south entrance basement area across from Robin's Coffee, and that's its temporary location until about mid-September, in which it will have its final location outside the new entrance at St. Boniface's Emerge. We're moving it partly because of construction.
Got it. How was it funded, this machine, and obviously the contents in it?
So it's a variety of different supports. We have BMO involved, we have CanFAR, we have Reach Nexus. There's also private supports as well. And so it's a culmination of all of those initiatives, plus public health providing, for example, the needles and the sterile water for injection kits. But it's been a culmination of a variety of different factors. We definitely are, it's at the front of mind also about the sustainability
Hmm.
going forward because this is not, there's no cost associated with these supplies. And so part of the initiatives going forward will be seeing how many supplies we're going through, at what frequency, and at that point, looking to what other resources we potentially have to be able to upkeep those supplies.
Yeah, because the government, if it were government funded, there would be stability there. But you're talking about private donations and different businesses supporting, and so this is. I was going to ask you about in the long term what happens. I want to ask you about something else. So we talked about what's in the machine, some samples, but there's also video screens that will help people with explainers. Is that right?
Correct. Quite frankly, the screen is quite cool. You have the opportunity to be able to tap which product you're interested in. And for example, if it's a naloxone kit, it will tell you about overdose. It will tell you how to utilize a naloxone kit. It will give you that information. The machine is really interactive. There's also a French component as well, because of course, St. Boniface being bilingual, but it allows the person who's coming up to the machine to learn about the supplies and what's in each package. And then additionally, of course, have the education needed to be able to utilize the supplies. It's not like a typical vending machine where you see that Coca-Cola bottle and you click A3. It's completely digital, and then you click an image of the product that you're interested in, and then you get a ton of information about that product.
I understand it'll also be able to help and be used as a way to offer information if there's like a warning of a bad batch of drugs, for
Yes.
example.
Yes. So the interface of it, it's effectively like a large computer. You can put information about public health concerns, potentially with substances that are around a community. There's also access to just available resources. So there's almost like an index where people can try to seek other supports that they are looking for. And so it's meant not just as the dissemination of these supplies for individuals, but you're absolutely right, information sharing too.
The Healthbox is targeted and available, I understand, to those 16 or older in Canada. How does that How do you make sure that that happens? How can the age limit be tested, given that it's a vending machine, it'll be in a public area, and obviously it's free?
So when a unique person goes up to the machine, they are prompted to effectively pick a color, pick an animal, and then input a year of birth. Obviously, there are limitations within that where potentially a younger person could not pick the accurate year of birth, but we are making the assumptions that when people are trying to go in and remember what type of unique user ID that they have, that they're likely going to have a fairly accurate year of birth.
So there's a little bit of good faith involved here.
There is definitely good faith involved here.
Yeah. How important overall, I mean, you alluded to this throughout all of your answers, but how important are initiatives like this when it comes to harm reduction in Winnipeg right now?
So there's lots of different avenues for harm reduction in the sense that you have street connections, you have other public health agencies, you have communities of service around CB that do provide supplies. But unfortunately, Manitoba right now has a significant increase and stable increase in substance use in general. And now we're also seeing other secondary consequences that can come from that, including HIV, infective endocarditis, and a variety of other secondary health concerns. Those health concerns, of course, are not only harmful potentially to the person that may contract them, but they're also quite frankly, increase in healthcare resources that are then meant to help those secondary consequences. So it's partly reducing just even in general the types of healthcare needs that people are going to maybe have as a association with their substance use. And so really trying to reduce infection and make person's quality of life more better, arguably.
Mm-hmm.
And so it's multifactorial, right? Because naloxone kits, of course, will also prevent overdose deaths too. So it's meant to help us in many capacities and to create more access within our community.
Good luck with the unveiling later this morning. Thank you so much on what's going to be a busy day. I suspect making time for
Yes.
CBC early. Thank you.
Thank you.
That is Katarina Lee Amajuri. She's a clinical ethicist at St. Boniface Hospital. And so that vending machine, by the way, another tool in the toolkit to help folks, is going to be officially launched later today.